Good morning. My name is James Strata. Thank you very much for giving us the opportunity to introduce to you what we believe is the next chapter in Cerner's innovation trajectory. We see a great opportunity to position virtual healthcare as a core area for growth and believe that Cerner is in a great position to leverage the hype we are seeing today as more clinics rush into the virtual healthcare implementations to sustain their practices amid pressures caused by COVID-19 and the new normal constraints on in-person healthcare. Our team has undergone an iterative process to uncover key questions and come to the final conclusions we are sharing with you all today, and addressing perhaps one of the most fundamental questions in guiding the innovation process, identifying the who. Through a detailed job-based segmentation process, we were able to identify the outpatient healthcare clinic as the microsegment of focus. There is a strong body of evidence that virtual healthcare adoption rates are highest among family physicians and outpatient healthcare clinics, or what is often referenced as primary care providers or managers, further referred to as PCMs. Specifically, we identified over the course of the past year physicians needing to adapt quickly to try and get their patients the care they need without in-person visits. In a post-pandemic world, we continue to see an expansion of virtual healthcare as a key enabler in the transformation to the value-based primary care, aided by the increased use of technology to cut back on the exaggerated high costs and inefficiencies of the existing medical care model. Simply put, primary care is at the front line of public health, and we will continue to see investment in this area in the years to come. As we look to the virtual healthcare makeshift implementations available today for primary healthcare providers, we realized an underlying circumstance of struggle presented in the lack of integration between the different connectivity systems currently in use in primary care managers to conduct virtual healthcare. But what does this really mean? Lack of integration between the electronic healthcare records and virtual healthcare solutions present PCMs with a variety of interrelated struggles. We choose to highlight a few that we believe are detrimental to the quality of healthcare experience provided experience both by the provider and the patient. The first moment of struggle is represented during the attempt to establish and maintain a connection with the patient on the other end of the virtual healthcare visit. It often takes several attempts before a call will flow smoothly. With 20-minute slots allocated per virtual visit, PCMs find themselves rushing from one appointment to the next, leaving the patient feeling rushed through their appointment. The second struggle we see is around charting delays, with the PCM having to retranscribe notes from the virtual healthcare solution into the electronic healthcare system, or EHR. This, in turn, creates two fundamental problems. First is extended working hours that result in burnout and PCM churn, which has become a major problem in primary healthcare clinics today. But second, even more important, is the increased risk of error while re-entering data into the EHR, creating liability both for the PCM and the practice. With that in mind, we approached our innovation discovery process grounded in our vision. We basically set out to answer one question: how can we empower the primary care provider to conduct an end-to-end virtual healthcare visit with the patient at the center of the healthcare experience as opposed to using external tools? What blockers do we need to remove? What key targets do we need to meet? And how do we use Cerner's strategic leverage in pursuit of this vision? We set out to design a solution that responds to the core value targets and unblock key struggles faced by our segment of opportunity. We chose to focus on enhancing the connectivity to the patient while simplifying the connection and scheduling process, ensuring full interoperability between the virtual healthcare system and the broader electronic healthcare record solution, improving visibility of the PCM and one-point access to all patient and clinical data, and finally ensuring the highest security protocols are in place in support of a HIPAA-compliant virtual healthcare operation. Turning it over to Rasha now, who will continue to present our Agile innovation strategy. Rasha?
Thank you, James. Ladies and gentlemen, my name is Rasha Ali, and I'll be walking you through the first two stages of the value innovation process this morning. We adopted an iterative process to ensure that our solution meets customer priorities and that we have a compelling value proposition in place that is able to achieve those needs through a viable business model. First, we looked at customer priorities and classified them in terms of the current pains or the struggles that our customers are undergoing as they try and conduct the job of virtual healthcare, as well as the desired outcomes they are hoping to achieve when they deploy a virtual healthcare solution. Zooming in on the current pains, we confirmed through extensive interviews with healthcare providers that the following are the main pains that they're struggling with. Appointment interruptions and delays, which are consistently happening due to an unreliable third-party communication system, a charting backlog, with every provider having to go back and retranscribe the details of the virtual health visit into the electronic healthcare record, transcribing errors, with dual transcribing increasing the error risk, putting the patient essentially at risk, and also increasing the liability for the provider in the clinic. Extended workdays, with a lot of those providers struggling to maintain an acceptable threshold of work-life balance. And finally, task duplication will increase the administrative workload for the provider, taking them away from the job of patient care. We then looked at the desired gains and managed to classify them under 4 main priorities. The first one is related to streamlined communications, connecting reliably to patients every time. A predictable workflow, ensuring that every provider is in control of his or her schedule. Seamless charting, whether they are prescribing medications, ordering labs, RADs, or medical referrals, they need to be able to do that with ease. And finally, an overhead reduction, essentially reducing the administrative workload and allowing them to focus on patient care. With that, we have confirmed the customer priority validation, and we are ready to move into the next phase of the value innovation process. The next phase of the value innovation process identifies how impactful our value proposition is in response to the validated customer requirements. At the core of our value proposition is a modular integration of the virtual healthcare solution into the broader Cerner EHR system. This, in turn, offers providers with a single pane of glass, where everything they need to conduct healthcare resides in the same system. The familiarity of the Cerner interface enables faster adoption and deployment timeframes. The virtual visit connection assistant ensures a seamless connection to patients every time. And finally, the congruent charting integrity aspect of the solution ensures that the risks identified earlier around charting errors have been addressed. When it comes to the business model, we identified the core pillars of going to market. These include the key resources available to Cerner today to develop and launch the virtual healthcare solution, the core activities that are required to build, maintain, and launch the solution, the key partnerships that need to be in place to ensure we have an end-to-end compelling value proposition, the cost structure associated to development, maintenance, and hosting of the solution, the revenue streams or incremental revenue avenues that are available to Cerner today through launching the virtual healthcare solution, as well as the customer relationship pillars, ensuring customer management, satisfaction, and retention after deployment. Among the key considerations that we wanted to bring to your attention today is that we are primarily focusing on the Cerner existing install base. This provides us with a sizable market segment that is already invested in Cerner and will therefore have a much higher propensity for adoption and deployment. We also wanted to highlight that development of the virtual healthcare solution will entirely happen in-house, leveraging the capabilities of the Cerner development and quality assurance teams. And finally, when it comes to the business model, we are following the same Cerner per user per month subscription model. More details on the cost-benefit analysis will be shared later in the presentation this morning. With that, ladies and gentlemen, we have crossed the business model gateway and are ready to move into the next phase of the innovation process, I will hand over now to my colleague Neil Alexander, who will walk us through the demand creation strategy as the next phase of the innovation process.
Hi, I'm Neil. Let's move forward to the next phase of this validation process. The first thing we did was ascertain an exhaustive set of value targets. We learned that many of those undershot value targets had congruent struggles. These became the focus of our solutions. Those struggles were that providers had to use multiple platforms to connect to patients and chart, that there was limited or no integration between the platforms, that no automation occurred between the virtual platform and the patient chart, and many solutions had no HIPAA compliant security or data sharing capabilities with patients and/or other entities. We next moved on to develop our demand creation strategy. Here we focused on outpatient primary care providers since this is where most virtual care appointments occur. Initially, we considered a broader segment, but we discovered that family care clinics have a set of unique and uniform needs that we believe we will be able to satisfy through targeted products and services. Additionally, most other non-general practices do not readily allow for virtual visits due to typically requiring some sort of blood work, scanning, or direct inspection by a physician. The primary care physician's circumstance of struggle is further accelerated by the current COVID-19 pandemic, with more primary care clinics seeking to offer a viable telehealth service and struggling to do so and meet the demand due to the limitations of their current solution or having no current solution at all. Now allow me to share with you a little about our market entry strategy. The Medicare program has recently increased geographic servicing flexibility as well as loosened the requirements for online prescribing. Hospital compensation for virtual care is about to become lucrative as opposed to just efficient for the clinician due to these increases in Medicare reimbursement and removal of certain restrictions. While the sudden advancement in virtual care adoption is exciting, it's caused many non-integrated, inefficient, and security-compromised solutions to be put into use. This makes this an excellent time to enter the competitive market with our new solution. Our intention is to provide a virtual care solution with superior value for PCMs, and one that's fully integrated with Cerner EHR. Early adopters of this platform will have a competitive leg up on their competitors, who are struggling to use their current systems with third-party platforms to meet the demand of virtual care. There are three main reasons we believe we will be able to add value that will not be easily duplicated. First, EHRs have an extremely high switching cost, and EHR contracts are typically written for at least a 10-year term. Second, since our virtual care solution will be integrated with the Cerner EHR, there's much less of a chance for competitors or new market entrants duplicating our solution since ours is a native first-party solution. Finally, EHR systems are extremely expensive, difficult to develop, hard to support, and they don't become profitable until after a certain level of adoption has occurred. This positions Cerner well to discourage the new market entrants. Next, we use our value targets and demand creation strategy to design our prototype. The PCM desktop interface. This is where PCMs can connect to patients via a virtual care session and review patient information as well as chart on the current session. Once connected to the call, the PCM has one interface where they can see and talk to their patient, see the patient details, their labs, radiologies, and prescriptions all in one view while also being able to chart and order. Currently, patients log in using different modes of communication such as Zoom, Teams, or Skype, and they have difficulties connecting to the virtual care environment, impacting their overall experience. We pitched our prototype to a choice-based conjoint survey, and we received very positive feedback from the survey takers. Our solution specifically affects our identified targets. We've built a solid demand creation strategy that is both innovative and effective in our new healthcare environment. And lastly, our prototype was well received by our choice-based conjoint survey. For these reasons, we moved from designing our job solution to validating our opportunity. We're going to hear more about that from Misty.
In order to verify our opportunity, we conducted a choice-based conjoint, or CBC study, with 5 attributes. The overall results of our first study showed that Cerner Virtual Health received a preference of 71%, significantly higher than the alternative. In the first CBC study, we presented 5 attributes that create the most differential value compared to other solutions. We assigned these attributes 2 levels, that of our solution and that of the other solutions in use. The discovery platform, which is what we used to create the CBC survey, then allowed respondents to provide their feedback on which attribute level configuration they preferred. This slide shows the attributes we included in the survey, along with the differential value that the Cerner virtual care solution provides for each. Next, we conducted a second CBC study where we added the brand attribute and a third competing solution, the next best solution in use. The results of this survey showed that while Cerner still had the highest preference, the margins between the 3 solutions was slim. The study also revealed that price was the most important attribute. Using the Discovery Survey Simulator, we adjusted the price of Cerner down to $500, which was equal to that of the lowest priced bare-bones alternative, and we found that the preference for Cerner went up to 40%, while the competing solutions, Epic and iPatient, dropped down to 33% and 27% respectively. This shows that if we have enough runway, we can significantly impact demand by adjusting the price point if need be. Here on this slide, you can see the cost, price, and willingness to pay for Cerner versus Epic, which is the next best solution in use. This demonstrates that the cost component for both solutions are nearly identical, but the value generated, as shown by the willingness to pay, which is designated as WTP here, is materially different. The effect of this is that the Cerner product has a longer runway, if you will, and the ability to generate significantly more value to the customer. When correctly priced, as Cerner is at $850, consumers will choose Cerner. This will enable Cerner to retain existing customers and create significant pull to strip customers away from competing solutions. A review of our ecosystem blueprint allowed us to analyze our supply chain and customer connections to identify possible impacts to delivery of our service. We started with the customer, the healthcare provider organization, and worked backwards from their customers and end users through our chain to our suppliers and internal teams. In doing this, we identified only a medium risk with the third-party video chat apps or providers, the video meeting apps that are used by patients connecting to the meetings, and the patients themselves. These risks we have directly mitigated by appropriate product delivery to our customers' patients, which includes an easy-to-use user experience that reduces the entire connection to 1 to 2 button presses without any further complexity. We have also ensured that there are support agreements in place with our third-party video chat app providers to provide assistance with API and development integration efforts as needed. Our revenue model reflects that there is a huge current install base to target with almost 65,000 customers. We only need to acquire 1.17% of that to meet our 26% profit target in our first year of launch. Our current market share is 26% of total family health providers. We expect that Cerner's primary platform will continue to gain market share and that the virtual healthcare option will be a value add that incents customers to switch from competing solutions. Even with our current customer base, we expect to earn at least $112.5 thousand in revenue per month for a total forecasted revenue in year 1 of $1.35 million. The cost and profit assumptions from which our revenue model was based include $1.2 million in total upfront costs. This is made up of product development, launch and awareness campaign advertising, product management costs, and development support services. We expect these costs to be recovered over the first 5 years. Our operational costs total $955,000. This includes an expected cost of goods sold of $750,000, which is made up of ongoing product development and management costs. Our general and administrative costs are expected to be ongoing at roughly $205,000 and are comprised of sales and marketing spend, third-party licensing costs, and online services hosting fees. Profit assumptions are based on an initial target of 750 customers in the first year. This target is only slightly more than 1% of the addressable market. At 1% of the addressable market, we are forecasting to generate $1.35 million in annual revenue, with $395,000 in operational profit, which produces an operating margin of 29.27%. In closing, we believe that our team has developed a viable business model with a great job solution fit that brings our customers the best value, and that our business plan will effectively bring this solution to market. Thank you.